For a private dental associate, clinical excellence is a physical reality. They only generate value and their expertise only benefits the patient when they are physically present at the chair. This creates a cycle of high-volume repetition. Roughly 30% of every clinical day is spent repeating the same foundational explanations about ceramic crowns, restorative materials, or the necessity of a root canal. Over time, this repetition creates a cognitive drain. A highly qualified clinician can feel constantly swamped by basic communication and administrative loops, rather than the complex dentistry they were trained to perform. This is the structural reality of Asset Zero. When a patient leaves the surgery, the diagnostic brilliance and clinical logic shared during the consult effectively vanish from the record. Trading physical time for repetitive patient education leaves the clinician professionally vulnerable. Without a portable record of their expertise, their reputation remains tethered to a specific chair in a specific practice. The common advice for an invisible clinician is to build a personal brand. They are told to stand in front of a ring light and perform for the camera to capture attention online. Most serious clinicians reject this. The influencer cringe and fear of peer judgment often lead them to stay digitally invisible to maintain their clinical dignity. However, maintaining professional standards should not prevent a clinician from building digital leverage or reaching a wider patient base. Dental Amplify is a clinical information dissemination system designed for professional leverage. It focuses on the structured sharing of expertise, not social media performance. We capture the clinician's diagnostic logic and treatment philosophies, consolidating these scattered insights into a single digital node. This data forms specific risk and benefit briefings for procedures like implants, finally mapping onto a high-fidelity digital avatar that replicates the clinician's voice and likeness. This creates a digital replica of the clinician's voice, capable of delivering pre-approved clinical education to patients at any hour of the day. Expertise is no longer limited by physical presence. It becomes an automated tool that works independently of the clinician's time at the chair. Automating clinical communication naturally raises concerns about professional liability and meeting strict regulatory standards. The system addresses this with a dedicated compliance layer. Every script passes through filters checking content against GDC, ADA, and APRA regulations. Crucially, a human-in-the-loop requirement means the clinician must manually review and sign off before the digital twin delivers it. These rigorous guardrails mitigate regulatory risk. They provide a structured framework that transforms digital education into a clinically responsible system for sharing expertise. The impact begins before the patient even enters the surgery. They can review their informed choice loops at home, absorbing the details of their treatment at their own pace. Pre-educated patients arrive with reduced anxiety. Because the foundational information has already been delivered, they enter the consultation with highly informed, specific questions. This changes the pace of the clinical day. By letting the digital twin handle the repetitive briefings that usually consume the first 15 minutes of a consult, the clinician can focus entirely on the complex decisions that require their direct attention. Providing consistent post-care guidance also helps manage patient uncertainty. It addresses common recovery concerns automatically, which reduces the administrative pressure on the clinic staff and lowers the frequency of out-of-hours calls. Automating the repetition elevates the quality of the in-person encounter. It is a shared win that improves the experience for the patient, for the clinician, and the practice. The clinician has effectively solved the problem of Asset Zero. They now possess a portable digital asset that contains their entire clinical communication framework. This digital intellectual property travels with the clinician throughout their career. Their professional voice and reputation are preserved and work on their behalf, regardless of which practice they are in. Building a preserved, structured system of expertise allows professional authority to scale. It ensures a clinician's clinical voice remains active and accessible far beyond the physical chair.